Hello everyone. So my name is Debbie Grayson. I'm laughingly referred to as the Godmother of Pharmacology. For my sins, I'm a pharmacist of 30 years and I'm also a nutritional therapist, have been qualified for 10 years. The purpose of my YouTube channel is to bring more awareness of the use of medication, diet, lifestyle and supplements to the general public and the medical profession. And I very much try to find the middle ground between the use of medication and supplementation. So hopefully you'll enjoy this video, and I hope to bring more videos over the coming months. And if you do like my content and you want to subscribe, that would be great too. So the purpose of this session is to talk about digestion PPIs, how that influences B12 levels, and then how to manage reflux and digestion without PPIs where appropriate, so that we can actually reduce the impact that might be having on people's B12 status. So hopefully you'll find this session quite useful. So to start with, let's just do a quick guided tour of the digestive system. So digestion actually starts in the brain. So when we think about eating, when we smell food, when we see food, when we anticipate food, that triggers a cascade of signals to the digestive system that says food is on its way. And that anticipatory process is called the cephalic response. Now that is reliant on the quality of the food that you're going to eat. So if you're planning on having a rice cake, you're not going to get as much of a cephalic response as you're going to have your Ben & Jerry's or your Haagen-Dazs ice cream. So the more excited you are about your food, the better your digestive system works. And that's not giving you permission to live on ice cream, by the way. So it really does make a difference about how you prepare the body for food. And the problem that we have with digestion is that food is so available these days that we literally can think about having some food, grab it off a shelf and shove it in our mouths before our bodies even had a chance to make that connection. We can literally go into any shop, buy food, eat it before we've even contemplated the eating process. And that's a lot of the reason why people suffer with their digestive system, because we become disconnected from that process of cooking food. My mum, when I was a child, would cook food. Some of it would be good, some of it would be not so good. I'd get more excited about the good food and I'd digest that much better than the not so good food. She's not a very good cook, and I'm going to be in trouble when she sees this, but that's another story. So once we've thought about that food, we then actually put that food in our mouths. Chewing starts that digestive process. We then get the release of digestive enzymes. We get amylase in our saliva. And then as we start to move through the process, the food moves down into the esophagus. There's a muscle at the bottom of the esophagus where it meets the stomach, and that's called the lower esophageal sphincter. That should open to allow food in, and that should then close to keep the food in the stomach and prevent it from coming back. So it should open and close as we swallow, and it should remain closed to prevent that backflow of food. That doesn't always happen, and we'll talk about that in a little while. It then travels through into the stomach. It gets mixed with hydrochloric acid, which is produced by the stomach to help with the breakdown of proteins. And it then also gets mixed in as it moves further through the digestive system, and it's affected by digestive enzymes, bile, and various other elements. And what we know is that this process happens to not only help us to break our food down, but it also happens to enable us to absorb the nutrients from our food. And it's all reliant on the step before. So if we don't have enough stomach acid, we don't get enough bile production, we don't get efficient production of digestive enzymes, but we also don't get the production of something called intrinsic factor. An intrinsic factor is made by the parietal cell, and that enables us to transport B12 into the body. So we often know that when people have issues with their parietal cell, or they've got issues with intrinsic factor, then they'll often have issues with vitamin B12 levels. And we know that things like proton pump inhibitors, omeprazole, lansoprazole, impact the production of intrinsic factor and the absorption of B12, not in everybody, but in a lot of patients. So we do see a lot of issues with B12 levels in patients that are taking proton pump inhibitors. And the purpose of this session is to talk about how we can manage that process and how we can support the digestive system to reduce the need for PPIs where clinically appropriate. So hopefully you'll get something from this session, and we'll look at some questions later on. So if we think about that digestive process, it's controlled by our nervous system, and it's controlled by our parasympathetic nervous system. And what that means is that's the part of the nervous system that we have no conscious control over. The body knows what we need to do and how we need to do it, and it controls the process. Now, there are two parts to our parasympathetic nervous system. We have our fight or flight system, which keeps us alive and helps us run away from lions. And then we also have our rest and digest system, which supports the digestive process, but also supports the repair of the body generally. So it's like a seesaw. So if we're in fight or flight, we're not in rest and digest. So if we're stressed, that means that we're unable to digest our food because our body doesn't want us digesting food when it's preparing to run away. So if you're always in a stress state, your digestive system is always going to be compromised because it can't function effectively when it's trying to protect us from danger. So that's one of the big reasons why lots of people suffer from heartburn and indigestion, is because the body really doesn't want us to be doing that because we're in too stressed of a state. So dealing with that is really important in managing that digestive process. And then the way we eat food, the way we prepare food, where we are when we eat, all impacts that digestive process as well. So before we go into that in a little bit more detail, what I'll be talking about later is what we can do to support that digestive process to reduce the impact of reflux. And we'll look at other things that impact reflux so that we can minimize the effects of it without having to rely on a PPI. And we'll also talk about when a PPI is essential and when it has a key role. So hopefully you'll get a lot out of tonight's session, and I'll be doing more sessions that you'll be able to catch up on that will go into more detail. I could talk for days and I've only got an hour and a half, so you'll have to bear with me. So if we think about how a proton pump inhibitor works, because I think it's probably good to cover that before we look at sort of like how we're going to support the digestive system beyond that. So within the stomach, we have something called a parietal cell. And essentially that cell is responsible for producing hydrogen, which then goes to make hydrochloric acid in the stomach. And the theory behind reflux is that we're getting hydrochloric acid coming back into the esophagus, causing us heartburn and indigestion, and that we need to reduce that hydrochloric acid to reduce the damage that occurs. It's not quite that simple. It isn't just hydrochloric acid that damages the esophagus. It can also be bile acids. It can also be pepsin and other elements from within the digestive system. And the problem is less to do with the amount of hydrochloric acid that's being produced. It's more to do with the fact that that sphincter isn't holding the stomach contents in. And it's the ability of those stomach contents to come up into the esophagus that causes a problem. But if we think about what a proton pump inhibitor does, is it prevents the production of hydrogen ions by the parietal cell by permanently damaging it. So if we can't produce hydrochloric acid, then we're not going to get hydrochloric acid entering the esophagus, causing damage. And that's the principle by which it works. Unfortunately, the byproduct of that is we get much reduced digestive capacity. We get lots of issues of nutrient deficiencies, B12, magnesium. We can get things like diarrhea, constipation, IBS type symptoms, and we can start to generally feel not very well. So when we take a proton pump inhibitor, what happens is the body starts to make more signals to tell the digestive system to make more acid, not realizing that that message doesn't get through. And what happens over time is we get too many chemical messengers. And what happens for a lot of patients is they might have been taking a proton pump inhibitor for a short period of time, which is the recommendations by NICE, the clinical excellence people. And when they stop their PPI, all those chemical messengers have now got lots of parietal cells that can make hydrochloric acid. So what happens when you stop taking a proton pump inhibitor is you then get what we call rebound heartburn. And that rebound heartburn is often 3 to 5 times the amount of acidity that you would have had before you took the PPI. So a lot of patients think that they must really need that PPI because look what happens when we take it away. And that's where a lot of the problems come, because patients then get stuck in this spiral of needing to take a PPI all the time because they think that their body really, really needs it. Now, this will eventually settle. And what we need to do in the meantime is we need to make sure that we're protecting the esophagus. And I'll talk about how we can do that later. So we do really need some digestive capacity. Now, if you're a patient that has Barrett's esophagus, which can do quite significant damage to the esophagus and increase your risk of things like esophageal cancer, or if you're taking medication which can cause damage to the digestive system, if you're taking non-steroidal anti-inflammatories, anticoagulants, then you'll be given a proton pump inhibitor to protect the digestive system. In those instances, that proton pump inhibitor is doing a really, really valuable job and needs to remain. So it's really important that if you're taking your PPI for a real clinically significant need, that you do continue to take it. What's also important is that you're having your B12 levels measured and that your B12 is managed. And obviously, if you have a significant B12 issue and you're having injections, then that overrides the impact of the PPI on your B12 levels, which is fine. But for a lot of people, what they're normally experiencing is just diet and lifestyle driven reflux. And this is why looking at how we eat our food and the foods that we eat is really, really important, because we can manage heartburn and reflux really simply with some simple diet and lifestyle changes that reduces the need for us to take the PPI. But what's really important is that we make sure that we're not having heartburn that affects the esophagus and can then cause damage, because that's how Barrett's esophagus materializes. So it's really important that if you are having heartburn symptoms, that you're protecting the esophagus. And one of the things that I advocate patients with reflux that's not continuous do is take something like an alginate, like Gaviscon. Because what Gaviscon does is it plugs the gap at the top of the stomach where that sphincter isn't doing its job to prevent the stomach contents from coming and doing the damage. So if you are only having occasional heartburn or you're having episodes of heartburn when you've not been very good, then using Gaviscon can be a really good tool to manage that without impacting things like your B12 and your nutritional status. So it's really important to be aware of the damage that's potentially being done. The main thing is that we don't have that damage. Reducing the likelihood of that damage is what I spend a lot of my time trying to advise people around. So what sorts of things do we do that increases our risk of heartburn and reflux? Well, the first thing is eating when we're stressed. Now, life's stressful. We know life's stressful. Every time we turn on the TV, there's the latest disaster in the news. Everybody's running around. It's Christmas. There's lots of stress. We can't avoid it. But what we can do is we can minimize some of that external stress just for the time that we're focusing on eating our food. So if you think about not scrolling on social media, not doing your emails, not eating at your desk, and actually taking away any external stresses that you can, so that you're minimizing the stress that you're being exposed to. And that can make a massive difference in enabling the body with that digestive process. And one of the things that I often advocate is to do some relaxation exercises before you eat, especially if you're prone to digestive symptoms. So that can include doing some box breathing, spending a couple of minutes doing a guided meditation, or my personal favourite is to do some alternate nostril breathing. And I'll demonstrate alternate nostril breathing in another video, because it needs to be a little bit more close up so you can see what I'm doing. But you can also Google alternate nostril breathing. There's loads of YouTube videos showing you how to do it. And what that does is it switches the body from a sympathetic state, fight or flight, into a parasympathetic fight state instead. So it can be really good for just kicking you into that digestive mode to help you be able to digest your food. We also need to spend some time thinking about our food, allowing the body to prepare itself. So how can we do that? We can prepare our food from scratch, which may or may not be appropriate dependent on your work-life balance. But if you're not preparing your food from scratch, you can actually start to think about what you're going to eat at least 20 minutes before you're going to think about it. So what are you going to have? What does it smell like? What does it look like? What does it taste like? How does it make you feel? So that you actually start that cephalic response. 20% of your stomach acid and digestive capacity comes from that sort of thought anticipation of food. So that's really, really important to do that before you eat your food. The next thing that you need to do is you need to make sure that you're sat with good posture. So lounging on your sofa, watching TV, scrunches up your digestive system, makes it much harder for food to move through. So sitting at a dining table, having good posture can actually help with the movement of food through the digestive system. And then the really important element of this whole process is not inhaling your food. Okay, so I'm sure many of us are running around trying to do 10 jobs at once, and it's really easy to shovel food in and virtually swallow it without any chewing. So ask yourself, when you've eaten a meal, how much did you notice what you ate? How quickly did you eat it? Are you always the first person to finish? Because you really want to be the last person to finish. That person that everybody's like, come on, I'm ready for my next course now, have you not finished? And you really need to be aware of how much you chew your food. And it's a case of there's no magic number of how many times you chew. If you Google it, there'll be like 30 chews, 34 chews, 40 chews. It's actually chewing it sufficiently that it goes to mush and that it's easy to swallow, which is probably a lot more than most of us do. I'm equally guilty of chewing at a rate of knots and then thinking, yeah, that probably wasn't the best for my digestive system. And a really good technique is to actually put your knife and fork down between mouthfuls. And it's just a reminder to slow down and take time to chew. Because when we chew, we're breaking the food up. So we're helping with mechanical digestion. But we're also mixing it with salivary amylase and other digestive capacity to help move the food through the digestive system. And that is really, really important. And if we do that, we're giving our bodies the best chance of digesting our food possible. And because we've done a lot to support that digestive process, food moves through the digestive system at the correct rate. When we don't digest properly, we end up with food sitting in the stomach longer than it should, And what that can do is that can open up the sphincter at the top of the stomach and make it more likely for your stomach contents to come back. So one of the reasons why we have a weakened esophageal sphincter is when food isn't moving through quickly enough and it causes the sphincter to relax. But there's lots of other things that we do or that we eat that can impact that muscle at the top of the stomach. And given that we're not far from Christmas, this is not going to make me hugely popular. And I apologise for that now. But there are lots of foods and drinks that actually increase the relaxation of that muscle at the top of the stomach. And that includes chocolate, it includes peppermint, it includes coffee and caffeine, it includes alcohol, it also includes tomatoes. It can also be influenced by things like spices and fatty foods. So that pretty much wipes out everybody's December festive period, and I'm really sorry about that. The good news is that the more you focus on the digestive process and the posture and the chewing and the relaxation, the less your body struggles with reflux and digestion generally. So the more you can be really mindful around that digestive process, the more you can tolerate those foods that relax that esophageal sphincter. And for me, the devil is in the dosing. So the more things you're doing that don't help, the more likely you are to have reflux. The more you are mindful of what you do, the less likely you are to have reflux. And if you're getting reflux when you're in bed, a really important thing is to make sure that you don't do any of those foods or drinks at least 3 hours before bed, because on average it takes 3 hours for things to move through the stomach. So it'll be 3 hours when they're in the stomach affecting that digestive process. So if you are going to have a bar of chocolate and chocolate is a trigger for you, have it at lunchtime so that it's got plenty of time for that sphincter muscle to recover to normal function rather than having it an hour before bed. And everybody's different, so not everybody will have the same symptoms. Not everybody will have the same triggers. So one person might be able to tolerate a bar of chocolate but not tolerate a glass of wine. Somebody else might tolerate a glass of wine but not a cup of coffee. So whatever your triggers are the ones that you really need to be mindful of and you need to avoid. And as you improve your digestive system and you improve your stress levels and the way that you eat your food, the more tolerance you'll get. So it's really, really important to be aware of that. And of course, if you've got things like a hiatus hernia, then the impact of those foods is going to be greater because you've already got an issue with the way in which that muscle functions. But having a hiatus hernia is not a permanent sort of determinant that you're always going to have reflux. Yes, you're always going to have the ability for the stomach contents to come back up, but that doesn't mean that they always will. The more you focus on the digestive process, the more you think about not eating too close to bed, the more you manage the stress, the less likely that reflux is going to be. So hiatal hernias does make it harder to manage your reflux, but it is still possible. And for me, the main thing is we've got to make sure that we're not getting reflux coming into the esophagus causing damage, because that's what we need to avoid. That's where the increased risk of things like Barrett's and cancer occurs. We also need to think about things like being overweight. That obviously puts pressure on the stomach. That can make it easier for reflux to happen, as can smoking. So there are lots of lifestyle factors that can impact that. And, losing weight if you're overweight can help with reflux symptoms. It's not the only thing, it's another part of the chain. So the more lifestyle things we can do, the better. If you're getting nightly reflux, then sleeping raised in the bed, so either propping the bed up with some books or some bricks or getting a wedge pillow can reduce the likelihood that we're going to get stomach contents coming back. Sleeping on your left hand side makes it harder for stomach contents to come back, because when you sleep on your left hand side, the stomach drops a little bit, so we get a little bit of gravitational support. So that can then help. But by far for me, one of the biggest things is not eating within that last 3 hours before you go to bed, so that we've got time for the stomach contents to move through. And all of this can help with that digestive process. Now, if you're already taking a PPI, then the key question is the reason for taking that PPI. Because if you're taking that PPI because 10 years ago you had some indigestion and the doctor prescribed it for you, and when you tried to come off it, you got rebound, and now you realise that that rebound wasn't what you thought it was, then there is an argument that we should be able to remove that PPI and manage that reflux more naturally. Of course, that needs to be discussed with your doctor. It's within the NICE guidelines that patients should only be on PPIs for simple heartburn for a minimum period at the lowest dose possible. And that's fine. And I'll talk a little bit about how you can approach that in a minute. But of course, if you're on it for a greater clinical need, then it may or may not be appropriate for you to remove that PPI. That doesn't mean that you shouldn't be doing all of the diet and lifestyle recommendations to support your digestive system, because your body needs more help with digestion with the PPI than it does without. So thinking about posture, thinking about stress levels, thinking about chewing will help to minimize the side effects of your PPI and help you with that digestive process. So we've talked a little bit about stress, we've talked a little bit about the chewing process and the preparation, and we've talked about some of the things that we might need to do to reduce that muscle weakness to keep food in. And it doesn't matter who you are, what your health condition is, what your digestive capacity is, that is really where we all need to be focusing. We've really lost the connection to the eating process, and you'll often hear it referred to as mindful eating, that we just need to be more aware of what we do. And that's, for me, that's really, really important. And that's essentially why I do what I do, because so many people get caught in this cycle of needing a PPI because they get the rebound when they come off it, that they're just stuck in this spiral. And short term, if you've got gastritis or you've got an ulcer, a PPI is a really good tool, but it's when it takes over from being that short-term tool to being that long-term fix. But I would always encourage people to speak to their GP about the necessity for the PPI and the validity of you coming off it and having that conversation, because GPs do actually want to get patients off their PPIs, but they're not necessarily equipped to have the conversation around why you get heartburn, why you get rebound heartburn, and what that means for you as a patient. And that's something that I campaign about quite a lot, and that's why I spend a lot of time creating awareness. That's why I've created my YouTube channel. That's why I spend a lot of time in the press trying to raise awareness of when it's appropriate versus when it isn't. So if you want to come off your PPI and you've got the support of your GP, you cannot attempt to come off your PPI until you've done all of those things that I've talked about, because you need to make sure that you're giving your digestive system every chance possible to manage the flow of food and control the movement of food and stomach contents via that sphincter. So when you're preparing to come off a PPI, it's managing stress, thinking about where you are when you're eating your food, taking time to prepare your food physically or prepare your body for food physically, um, and making sure that you chew properly, avoiding those foods that relax the esophageal sphincter, and really getting it part of your daily routine. So it's not something that you just do every now and again when you remember what I've said. It has to be meal by meal. Okay? It has to become almost second nature. Once you've done that, I would say that needs to be for at least 4 weeks. Once you've done that and you're noticing that your digestion is generally improved and that you're getting less symptomology, then you can start to talk to your doctor about reducing the level of PPI. What I normally advise is that you go stepwise through the dosages for your PPI. So if you're on omeprazole, that comes as 40, 20, and 10 milligram. So I would spend a month doing 40, a month doing 20, a month doing 10, and then a couple of weeks of doing 10 every other day. And then by that point, you should be able to stop the PPI. You will get rebound, and you might get rebound as you come down, but that will eventually stop. The body will soon realize that it's no longer having a problem, and it will reduce that messenger system. In some people, that might happen in the space of a week. Other people, it can take as long as 6 months. There is no predicting how long it will take. It's entirely individual. It's got nothing to do with how long you've been on it. It's just down to how the body connects and realizes that it's an issue. What is really, really important is that when you're in that phase, that you are using Gaviscon to manage your symptoms. So you have to use Gaviscon every night before you go to bed, because when you lie down, it's more likely that the stomach contents are going to come back up. And if you know that certain things will cause you to suffer from reflux, so if you know you're going to go out for a meal and you're going to have a curry and you're going to have a glass of wine and you know that's going to trigger a reflux episode, take some Gaviscon with you. At the end of your meal, take the Gaviscon straight away so that you're stopping the damage before it happens. Once you've got the reflux, then it's causing the damage to your mucosal lining and it's almost a little bit too late. That's not to say if you get reflux out of the blue, don't take Gaviscon, but if you know in advance that something you are going to do is going to cause you reflux, then that's the best time to use the Gaviscon, is immediately after you've eaten it, so that you're holding it in. And that's really, really important. And it might be that you need to do extra doses of Gaviscon for up to 3 months until your body's settled down, and then you just use it as and when you need. And this is where once you start to know your triggers, you can then have a little bit more fun. So if you know that when you have a bar of chocolate, you're going to get some reflux, then have your bar of chocolate, take a dose of Gaviscon, but just don't do it every day. Okay? Think about how stressed you are, how good you've been, how prepared you are, making sure that you're chewing it properly, making sure that you're relaxing as much as possible so that you're minimizing the impact that that might be having on your digestive system. And hopefully that should help you manage that removal process. I have a bank of practitioners that I've trained to support patients with this process. I spend a lot of time talking to GPs about how to manage this process. And I'm going to spend a lot of time over the next 6 months engaging with various groups to try and get this as an accepted way of coming off PPI. Because the problem we have at the minute is that it's not widely known how to do this. But for me, the real thing is knowing that that rebound heartburn is not a sign that you really needed the PPI. It's just part of the removal process. the sign that you need the PPI is that discussion with your doctor about why the PPI was prescribed in the first place. So if it was prescribed for Barrett's, or it was prescribed for severe ulcers or gastritis, or you're taking medication, then that's a clear need for the PPI. But if you just went to the doctor because you were getting some heartburn or you had a cough, that's not a clear need for a PPI. If you can do the diet and lifestyle, the PPI can be reduced. Hopefully you've found that useful.